Hello and welcome, dear students. And now we are coming up with another case discussion on hepatitis and pregnancy. The last case discussion was on intrahepatic cholestasis of pregnancy, and I try to tell you how your Viva will rotate around the skin disorders of pregnancy when you speak about pruritus in pregnancy. All right. So my idea of making this case discussion is that what you speak in the examination, you are caught on that. So if you give a case history of a patient who's come to you with pruritus all over the body, you have prepared yourself for cholestasis of pregnancy, but your examiner is going to give you a very basic questionnaire of asking you, so fine, she's come with pruritus of pregnancy. Obviously she'll not be the person who will tell you I'm having cholestasis of pregnancy by giving her or furnishing the lab function test like LFT and all. And in that case, you'll have to start with the fact that she's having pruritus in pregnancy. How do you delineate her towards understanding that this is IHCP and not any other dermatosis of pregnancy? For that matter, you have to know the entire skin disorders that occur in pregnancy and those concurrent skin disorders which can also cause pruritus. How will you then differential diagnose all of them, thinking that it's not atopic eruptions, they are not prurigo of pregnancy, they are not polymorphic eruptions, they are not pemphigoid eruptions, they are just normal cholestasis of pregnancy. So this was the idea behind telling you that case discussion. And on similar lines, we have today's case. Today we are going to discuss about hepatitis in pregnancy, and you just see how we sail through this particular topic, because over here again you have a patient coming up to you with complaint of fever or jaundice. How would you know that this is hepatitis in pregnancy and not any other fever along with jaundice? So I present my case. My patient X, aged 32 years, teacher by profession, wife of Mr. So-and-so, is a resident of so-and-so place belonging to the upper middle class by Kupuswami's classification, is an unbooked patient who is second gravida para 1 live 1 issue, with LMP being so-and-so with previous normal regular cycles, making her period of gestation around 27 weeks 5 days, came to the OPT with yellowish discoloration of skin with fever and vomiting since the past 2 weeks, referred from a private clinic. History of presenting illness. As per the patient, she was apparently alright 2 weeks back when she developed fever with nausea and vomiting. Fever was high grade, around 103 to 102 degree Fahrenheit with chills, and it lasted for 4 to 5 days. It used to subside on taking medications, but shot up again at an interval of around 6 to 8 hours. Patient also complains of extreme fatigue, weakness, malaise, along with loss of appetite, nausea and vomiting. There was no history of any abdominal discomfort, loose stools or constipation, no history of burning, micturition or offensive vaginal discharge. There is no history of any skin rash or any pustules or any eruptions. There is no history of any cough, runny nose, ear ache or throat pain. No history of mosquito bites or recent travel to endemic regions of malaria or dengue.
Okay, ma'am. What's the relevance of negative history here? And what are the different diagnoses of fever and chills in pregnancy?
Yes. So